some of the best tools that you can use in your practice. Intraoral photography is something that we recommend. If, by show of hands, just quickly, how many people have a camera? Okay, how many people take pictures on every patient every day? Excellent. Okay, we have a few. Very good. These are some of the photos that we can be taking if we're not taking them already. This is a perfect example of why the hygienist should be using the intraoral camera to take a before photo like this and then show a patient an after. We've all seen things that look like this. People don't know that they have this going on in their mouth. If it's not sharp and it's number 2 or number 3, they don't even know it's there. If we don't show them with the camera, they'll let that ride forever. These are all things that we have scripts in your handout to demonstrate to you how you can have conversations about a tooth that may just be a chief complaint. Very often we have a situation where a patient presents with this and they think that this is the only thing they need to address. But when we look more closely and we go ahead and we take pictures in other areas of the mouth, we find that there's a lot more to be seen. And just addressing this one tooth very often is not really the right thing to do for the patient. So to use the intraoral camera as frequently as possible, and we like to say it's a tour of the mouth. So in a hygiene situation during an exam, it's a great thing to take a series of photos. You always want to take a picture of something pretty, like that little smiling tooth that we had up on the screen a couple minutes ago. If you can find a beautiful tooth, almost every person on this planet has at least one beautiful tooth. Take a picture of that first and show them what a tooth in good health, a pretty, good, healthy looking tooth looks like. Then show them some things in their mouth that are not pretty and are not healthy, and demonstrate to them that we can restore them and we can get them back to a place of good health and restore them to their original state. Retracted smile photo. This is something that is grossly overlooked in most practices, even the practices that are really great with the intraoral camera. This is a skill that a lot of practices have not mastered. They don't, either number one, they don't have the right camera, or the people within the office do not have the skills to use the appropriate camera, so they just skip it. This is a huge practice builder, taking a retracted smile photo on every patient, obviously on your new patients, but if you've not been doing it routinely, then every patient becomes a new patient if you do it on your entire patient base. The interesting thing about this is that people will point out things that we don't expect them to point out. We think they're going to point at this, which they may, but they're also going to say, why is that whiter than everything else? Well, that may come up to be a conversation where this dentistry might be in very good condition, maybe serviceable, but now they might want to make everything else the same shade. So this could turn into a full mouth reconstruction or close to it, just based on the fact that they like this shade a lot better than everything else. They don't get this view of their mouths when they look in the mirror, and they certainly don't get it on a 17-inch monitor. Shade measurement is something that we encourage you to start doing within your hygiene department. We recommend that every hygienist has a shade guide in their room that's set up from light to dark just for the hygiene room, set up that way, so that you can take a shade, an initial shade on a patient, and you just start off by saying, I'm just taking this for our records, and then you can show the patient on that shade guide approximately how much lighter we can get their teeth. And most people, when they see their shade on the shade guide, they're going to look at that A3 and they're going to go, ew, because there are so many shades in front of it that are whiter. So that opens up a dialogue, and there is a script in your handout on how to approach shade measurement. This is a piece of equipment that Steve has in his practice that he loves. We're just going to skate past that for time's sake. Cosmetic Imaging. This is the person we use. If you don't have a chance to write this down and you want her information, please write it on your questions form. This is another tremendous practice builder. This person allows you to do this in a very cost-effective way. She is a phenomenal artist with somewhat of a dental background. This is probably the best thing you can do if you're looking to do more full mouth reconstruction and more cosmetic work. When you meet someone for the first time, if you take their smile and you do this and show it to them when you meet them next time for their consult, that's a wow factor. This is a huge wow factor. Just the fact that, number one, the technology is there to do it. It's very impressive to people, and most people don't realize how much better their teeth can look. So let's talk about hygiene. What is the most important role of any dental hygienist? It's to create value. And how do we create value? We need to create value by avoiding minimizing terms like it's just a cleaning. It's not just a cleaning. If you're an adult, and depending on what your belief system is, anywhere from 40 to 70% of all adults have some form of periodontal disease. It's usually periodontal maintenance, and it's always an oral cancer screening. Those words are much more powerful. It builds the value of what we do in our hygiene department. Many practices right now are suffering from a huge amount of cancellations in their hygiene department, broken appointments, people that are off track, their recall systems are really dysfunctional. This is the number one thing that you can do to correct that, is to, as a hygienist, know that your number one priority every day is to create value in what you do. If you have patients that are chronically missing hygiene appointments, it is not because the administrators have not done a good job confirming. It is because there was a shortcoming at the last hygiene visit, as far as value building is concerned. So this is something that we have created that we call the Periodontal Progress Report, and there is a copy of this without Dr. Katz's header on it in your packet.
So that you can duplicate it in your own offices and use it.
I like to compare this to when you take your car for service. When you take your car for an oil change to the dealership, when you're done, they give you a printout, and it tells you exactly how many gallons of oil, the type of filter, they topped off your windshield wiper fluid, they checked your brake lines, they did like 50 things. So when you get that bill and you see the number, you feel like you got a lot for your money. It validates the cost. So by doing this, and you'll see this packet, it describes the things that we do. We've taken blood pressure, we've reviewed medical history, perhaps we've done nutritional counseling, which we do very often and we don't get any credit for it or even make a big deal about it. We've done an oral cancer screening. We have encouraged the patient, we've provided them with MI pays, and we've given them instructions on how to use it. We've diagnosed some problems. So the treatment is written very specifically defined why the treatment was needed, not just what it is, but why we need to do it. And that's really important. And any further periodontal treatment. Now, we want to have this made into a triplicate form. So the first copy, the patient's going to get to take home with them, again, is that value build. So they have an understanding of what they got for their money. It looks very impressive. The second copy is going to go into their paper chart if you're still using them.
Or scan it into their
Scan it into the document center. The third one is going to go into a binder at the administrative area that will now be used for your short quote lists. In the event that you have an opening, whether it could be a perio opening, it could be a hygiene opening, or it could be an opening for the doctor. You now have, without pulling charts and trying to figure out what was written on the charts, you now have something that was probably written by the hygienist, so it's going to be much more legible than anything that the doctor wrote, that specifically defines why that treatment needed to be done. So when you use that for your short call list or your ASAP list or your unscheduled list, you now have a specific thing, should you get that patient on the phone, where even the administrative people can speak to them very specifically about why they need to have that treatment done and why they should want to have that treatment done today, which is the important thing. So then we move into something called the triple here, and ultimately the quintuple here. So the triple here works like this. When the patient is in the chair with the hygienist, we want all of you hygienists that are in the room to become experts at the diagnosis criteria of the doctor that you work with. So a good exercise to do that is to go through Google Images and find photos, if you don't already have a huge library of intraoral photos within your practice.
Or if any doctor wants, write down on your question sheet, you'd like a collection of photographs of decayed, fractured, or teeth with problems, and I have a small collection I can email to you.
So now the hygienist and the doctor are going to go through these photos together and establish a diagnosis criteria. And if the hygienist is not already extremely knowledgeable about what that criteria is, they will come to that agreement. So from now on, when there's a patient in the chair, and the patient has a tooth that looks like one of the photos that we saw a few slides back, the hygienist will say, Mrs. Jones, this picture that I've just put up on the screen, you have a giant crack in this tooth. You can see this big piece here is missing. When Dr. Katz sees a tooth that looks like that, he usually recommends a crown. You've not made any diagnosis. You've said to the patient that you're an expert, you work very closely with the doctor, you understand the doctor's treatment philosophy, and when the doctor sees a tooth like this, he or she normally recommends a crown. So when the doctor comes to the room for the exam, the hygienist will repeat exactly the same thing to the doctor that he or she just said to the patient. Dr. Katz, you see the picture that I have up on the screen? I just described to Mrs. Jones how she has that big piece broken there. I know that normally when we have a tooth that looks like this, we recommend a crown. Doctor gloves up, takes a look, looks in the patient's mouth, looks at the photo, looks at the patient and says, Susan, you're right. Mrs. Jones, you have a giant crack in this tooth. I recommend a crown. When the patient hears something 3 times and they hear a consistent message, they start to believe it's for them. Nobody
They also
wavered.
start to take ownership of their problem.
Correct.
And that's a key part of this, that it's not our problem, it's their problem. They have to understand it's theirs and they have to take ownership of it.
So now, the patient says yes to the care, and very often, practices do really well up until that point. And that's one of the common complaints that we get when we go into work in an office, that the clinical team feels like they do extraordinarily well with presenting treatment and getting case acceptance chairside, but they always say it's lost at the desk. It doesn't go through at the desk. So the reason why, one of the reasons why it doesn't go through at the desk is because they don't carry the triple here into quintuple here. So the person who takes that patient to the administrative area, and a key thing that you want to do with this, no matter how your practice is set up, if you are a clinical person that can get behind the desk from the treatment area, never ever do that. You always want to stay on the same side with the patient. Do not walk behind the desk and stand with the administrator, because now you're 2 against 1. You're on their team. You need to be on that patient's team. Walk the patient up to the desk and say to the administrative person, I just described to Mrs. Jones, Dr. Katz and I just described to Mrs. Jones how she has a crack on that tooth, and we're going to go ahead and schedule her for a crown and get that tooth looking healthy and strong, and it's going to last a really long time for her. Mrs. Jones, do you have any other questions? The clinical person is now going to go on to the next thing. The administrative person will now repeat again exactly the same thing. Mrs. Jones, Kelly just described to me that you're going to do the crown on that tooth. Let's go ahead and get you scheduled. Do you prefer mornings or afternoons?
If hearing it 5 times, you think that patient has any question that they need the ground. Okay, treatment presentation, gonna just run through it. It needs to be done in a non-clinical room. Patients feel threatened when they're sitting in a chair. It's like women who are in the stirrups in an obstetrician's office. It's just not a comfortable place to talk about your condition. So it's also a very threatening place for patients to be in a dental treatment room, so we recommend doing it in a non-clinical room. The treatment coordinator should be sitting with the patient, next to the patient, facing the doctor, because she's the advocate. She's the go-between. She's the person who puts a hand on the knee and says, do you understand everything the doctor said? Has he described it well enough for you? And then when the doctor leaves the room, they're there to discuss the financials with them sitting on the same side. It's very symbolic of being on their side. Okay, no interruptions, non-technical. I've passed around presentation folders which absolutely add value, like you were going for a better, finer car. When you go to look for a Mercedes or a Lexus or a BMW, it's a full color brochure, very similar to the folders that we just passed around for the dentistry that we do. It adds a feeling of quality. And you focus on the benefits, not on the treatment in the presentation. Everything we're doing is trying to raise the perceived value. As we raise the perceived value of care, the perceived cost goes down. Again, as we raise the perceived value, the perceived cost in the patient's mind goes down. So all the things we do, the first impression, the words we use, the relationships we build, our reputation and testimonials do wonders to raise the perceived value of our care.
So, one of the things that we can wrap up with, okay, we'll skip that one. How are we doing on time, Steve? Let's give everybody a time check, because we're a little later than...
Do we have your permission to stay 10 minutes longer?
We got a little bit of a late start. If we wrap in 10 minutes, can we keep everybody to stay for the raffles? Okay, awesome. Objections are opportunities. There are 5 things, 5 objections that people have. The first one is cost. The second one is fear. The third one is time. 4th is sense of urgency. And 5th is trust.
In your handouts, the way to answer each of these objections is well described. The important thing is that any time a patient asks a question, that's a sign that they're interested in the care. There are specific techniques to turn every one of these objections into an opportunity to do the dentistry. So look at that. If you have any questions about that in your handout, or ask for us to send you the manual scripts, and we'd be happy to discuss that with you on the phone. Practices that are achieving growth now are doing things differently than those other practices that are not. And so to change the success of your practice, you need to change the way that you do things. It stands to reason. Some of the things we talk about may not be comfortable for you in your offices. It's important to keep trying. These gentlemen, Colonel Sanders, Steve Jobs, Fred Smith of FedEx, and Tom Edison were great inventors and innovators. Thomas Edison said, "I have not failed 700 times. I have not failed once. I have succeeded in proving that those 700 ways will not work. When I have eliminated the ways that will not work, I will find the way that does." And so what we offer tonight is ideas that you can try. You may want to change them. You may want to alter them. You may want to try something completely different. The important thing is that you keep trying. And surround yourself with people who can help you, whether it's mentors or colleagues or your IT people or attorneys, accountants, friends who have successful practices. Your sales reps are immeasurable practice management consultants who are in 50 to 100 offices over the course of a month. What I recommend is not avoiding them and hiding under the desk when they come, but welcoming them and telling them that you'll listen to anything they want to describe to you, as long as they tell you one or two things that they've seen that has helped to make another office successful.